As you know, you've been prescribed eardrops by your provider, and that's to help try and get rid of this swimmer's ear that you have going on and get you back to feeling 100%. So, I just want to do a quick instruction with you on how to instill the eardrops to make sure they're going in effectively. Um, it will help if you do have a family member or somebody else who can put the eardrops in for you. It just makes it a whole lot easier. If you do need to do it yourself at some point, it's perfectly doable, but having an extra person is always helpful. So the first thing you're going to do, make sure you wash your hands nice and good, or the person who's going to instill the drops gets their hands nice and clean. Warm water, soap, and just scrub for at least 15 seconds to make sure their hands are clean. You'll take your bottle of eardrops, and you'll want to kind of warm it up a bit. So if you just roll it in between your palms for about 1 to 2 minutes, it'll get the solution a little bit warmer. If you do a cold solution, what can happen, it can cause a little bit of dizziness and, of course, be very uncomfortable once it gets put into the ear. So this just helps with the discomfort of that. Once it's been rolled in between the palms for 1 to 2 minutes, you or the person who's going to be doing the drops will take the top off. And make sure that once the top is off, nothing touches the tip of the eardrop solution. We want to make sure that's as clean and as sanitary as possible, so that way we're not introducing even more bacteria into the ear when we do the eardrops. Once the cap is off, if you're doing this by yourself, just tilt to the side. But since you're going to be having some help, you can lay down. So make sure the side, your ear that's infected is up. So that way the person who's doing the drops has it right there. You can help out by taking the top of your ear and just pulling back a little bit. You don't have to do it hard or make it painful, but just back enough so that the ear canal opens up a little bit more. The person who's putting the drops in the ear will want to put as many as instructed into your ear. So make sure the instructions are followed. Again, you don't want to touch the tip of the solution to the ear, but just kind of like that. So it's a little bit above, but we can ensure the solution's going in. And again, follow the instructions provided to you by your provider, as well as that's on the prescription for how many drops to instill. Once the drops are in, you'll want to keep laying on your side for approximately 3 to 5 minutes to make sure that the drops get all the way into the ear canal, and that way they can treat like they are supposed to. So make sure you stay on your side for those 3 to 5 minutes. While you're laying on your side, the person who put the eardrops in, make sure they put the cap back on to the eardrops nice and securely, so that way, again, we don't run the risk of the tip touching anything else and getting infected with more bacteria. So that's just a quick rundown of how to do your eardrops. If you have any questions, do not hesitate to get in touch with your provider or a nurse that can kind of walk through things or answer any questions you may have.